Well, I hope everybody's having a great Thursday. Like I said, we're trying to step up the experience here for you on these webinars so that when they replay back, you have a full experience that really helps you to improve the knowledge and empower you when you go and talk to your doctors or your family members or friends out there. So I want to talk about something here that's near and dear to my heart. Sounds a little weird, I know, I'm a little nerdy like that, but hyperthermia. This is a powerful, powerful therapy. A lot of people get confused with hypothermia, and I'll clearly delineate the difference between hyper and hypothermia. But hyperthermia it's advertised a lot, but understand a lot of people aren't actually using real hyperthermia. And by the way, as we go through this, we want this to be very interactive. So thank you for everybody attending, taking time out of your schedule to spend time with us. That's why we want to provide the best available product here for you, because you're taking time out of your schedule, so we're going to give you the best. And so hyperthermia, if you've got questions, please bring it. We're going to answer it, and we'll answer them right as we go through this. So it doesn't necessarily have to wait at the end. I've got somebody on standby to bring those questions. So Aaron, if we've got a question, you just kind of raise your hand and fire it at me. So hyperthermia. Great quote from Parmenides, basically pre-Socratic Greek philosopher from the 6th century BC. So we're talking about a long time ago. Quote, "Give me the power to produce fever, and I will cure all diseases." Now in the background there is some imagery. Thank you, Juana, for getting that in there. There is some imagery of the phoenix, the rising sun. This could be the rising phoenix. And according to legend, the phoenix lived some 500 years ago, or actually it has its origin back to ancient Egypt. But thinking about this, approximately 500 years ago, the legend was that it really was a picture of a rise from the ashes. And, we're here, it's fitting, we're here in the Valley of the Sun, Phoenix, where a city rose out of the ashes of the desert, right? And so when you look at the Greeks and the Egyptians, it was a visualization of immortality. It was a visualization of tying death into life. It is imagery of resurrection. It is imagery of rebirth. And so really when you look at hyperthermia, there's essence of rebirth, renewing, regeneration found in this therapy. And it goes, at least here in some of the historical documents, all the way back to 6th century BC Greece. And then Hippocrates, considered the father of Western medicine, "What medicines do not heal, the lance will. What the lance does not heal, fire will." And when they're referencing fire here, they're actually referencing heat. They're referencing fever. So he's saying, hey, if you can't cut it out, use the fever to heat it out, fire it out. So what is hyperthermia? Again, this is in contrast to hypothermia. Hypo meaning low. Hyper here is two Greek words, hyper and therm. So hyperthermia, it's two words. Hyper is the first, obviously, and it means rise. Therm means heat. So we're talking about a rise in heat, a raising of the body temperature. Now, we affectionately or unaffectionately know this as a fever. And understand, over the last 50, 60 years, medicine has looked on fever as the enemy, but actually fever is our friend. It's the body's mechanism to manifest the immune system to get rid of the enemies, both foreign and domestic, and cancer is a domestic enemy. There's a 2022 article in the journal Frontiers of Immunology, and it defined hyperthermia as this: a method of killing cancer cells or impeding their growth by increasing tissue temperature with an external heat source for a period of time. So the goal of hyperthermia is to raise the heat, to raise the temperature, and that's the term hyperthermia. Now, the procedure hyperthermia it is a procedure that is to put in a microcosm, to put in a therapy and imitate a fever. So hyperthermia is not fever induction, but it is a mechanical, conventional way to actually imitate a fever. Now, we'll talk as we go through history that there were many throughout history that actually induced fever. Hyperthermia is not that. Hyperthermia is mechanically mimicking a fever. Looking at the late 19th century and early 20th century, it was fever induction therapy that was being used. So we've kind of progressed from fever induction therapy to actually hyperthermia, mechanical. And what that enables us to do is to control it and understand that beyond the control, there's even aspects of what we can do in fever induction therapy available today, even with hyperthermia. So again, what is hyperthermia? It's forced heating of the body or tissues in the absence of a change in the hypothalamic temperature set point. So again, we're not changing fever. We're not actually causing a fever. And it is a method of killing cancer cells or impeding their growth by increasing tissue temperature with an external source over a period of designated time. And we'll talk just a second about dose and duration because these are very, very important. Dose being temperature, duration being time. And it's interesting because when you look at this, the target of immunotherapy, it's not disease. Disease, remember, is two words, lack of wellness. The target of immune system activation is the elimination of the disease. It's tapping into the body's design mechanism to eradicate all enemies. Again, there's foreign, that'd be virus infectious causes, and then domestic is the cancer. And so here we're talking about cancer. When we look at the pillars of conventional cancer care today, it's really a much different approach. It is actually interference. Instead of congruence or coherence, it is interference. Interference is the disturbance and hindrance or inhibition of a pathway or of a substance. And the four pillars, when you look at them from a conventional standpoint, and understand, I am a conventional medical doctor, but I'm also an MD homeopath that's licensed in the state of Arizona. There's surgery, chemo, radiation, and immunotherapy. But even the class of immunotherapeutics from a conventional cancer care approach, it is a interference approach. Versus when you look at immunotherapy, and that's where hyperthermia fits in the integrative mode, it is a coherent therapy, meaning forming a unified whole. And so what our goal here is to unite behind the whole of the immune system to let the immune system do its job and not destroy it in the process. And if you've listened to any of my podcasts or any of my writings in the past or webinars, I love history because as Steve Jobs says, you can only connect the dots of the future by connecting the dots to the past. Future tells us so much about the present, but also where the future is going. So let's go way, way back to the Egyptian physician Imhotep. Of the Mummy Hollywood series fame, no, obviously not the same, but he actually would use a poultice, this surgeon, he would use a poultice of herbs and place it on a tumor here, breast, and then actually slice through the poultice into the tumor to induce a infectious systemic fever. And so this Egyptian physician Imhotep in 2600 BC was actually tapping into this concept of raising the temperature, raising the heat, hyperthermia. And then you look at the documentation of the Egyptian Edwin Smith papyrus from 1700 BC, they describe the use of hot blades and sticks in the treatment of breast cancer. So again, using heat, different ways and different methods, but still documentation historically thousands of years ago. I mean, there we're talking about almost 4,000 years, heat. Hippocrates, again, father of Western medicine, a disease must be incurable if it cannot be cured by using heat. That was a famous quote attributed to Hippocrates. Again, describing heat. Looking at ancient Greeks medicinally, here Aurelius Cornelius Celsius, using hot baths. He wrote about the medicinal use of hot baths as heat therapy for the treatment of disease. And he had a famous quote attributed to him: "If he broke out in a violent sweat, he was considered cure." Heat, fever. And of course, Native Americans embraced the healing effects of heat by using hot sweat baths, hot mud baths, and hot sand. And not to be left out, the ancient Chinese culture and Japanese cultures were also looking and utilizing the effects of external heat in the elevation of body temperature for the treatment of disease. Then we look at the saint Paragan Laziosi. Interesting about this is where the phrase, this individual, this is where the phrase comes from, spontaneous regression. St. Paragan was a priest, Catholic priest, who had they suspect a sarcoma tumor. And he developed an infection, and this cured his tumor. So this is historical. And so, of course, he became a saint because of this in part. But this was one of the first documentation of that phrase, spontaneous regression. So obviously he got an infection, he developed a fever, and tumor went away. Didn't call it hyperthermia, didn't even call it a fever, but it was the elimination of a tumor because of the immune system activation, and it was manifested in the fever. The German physician, Dr. Carl D.W. Busch, published his work with fever induction therapy in 1866. Now, this was 25 years before Dr. Coley in 1891. And he used probably erysipelas, a superficial skin infection, which is a group A strep, to actually induce spontaneous regression. When you look at history books more recently and modern, it's Dr. William Coley, a surgeon here in the United States, who was actually frustrated in the treatment of sarcomas. And just like the St. Paragan, his work began in 1891 with his first publication, and it became known as Coley's toxin. Now, this is a little bit different than hyperthermia because this was IV treatment of killed bacteria that was a mixture of Streptococcal pyogenes and Serratia marcescens. And his goal was to induce a fever, so he was actually inducing a fever of 40 to 41 degrees Celsius. And this was his target because this was the prerequisite for the best results. And he used this in thousands of patients with a wide spectrum of cancer types: melanoma, multiple myeloma, lymphoma, cervical cancer, breast, ovarian. His longest remission, 47 years. So when we get excited about, increase progression-free survival by 3 months, that's awesome. When we achieve 5 years of remission, that's awesome. 47 years from a fever. Then George W. Crowell Jr. in 1962, a surgeon. He was actually directly destroying tumors at temperatures of 42 to 50 degrees Celsius, so really carrying that much, much higher. But here's what he noted. He could destroy the tumors at these ablative temperatures, but it would spare the healthy tissues. See, that's the beauty of integrative therapies. Just like vitamin C, just like curcumin, just like photodynamic therapy, they will target these abnormal cells, these abnormal environments, yet preserve the healthy cells. But, so history just documents all of this. But here is a study or an article in 2022 published in the International Journal of Hyperthermia. And there's a really interesting quote there. They said, since the 1970s, the anti-cancer effects of hyperthermia were investigated. So they're saying, well, with hyperthermia, this is really just a 50-year process. Well, I think Imhotep would disagree with that. I think the ancient Egyptians, as beyond him, would disagree with that. Hippocrates, Celsius, Native American culture, traditional Chinese medicine, Japanese cultures, St. Paragan. This has been going back 5,000 years roughly. So the history of hyperthermia, it's quite strong. And so when we look at hyperthermia, there's really 3 different approaches to it. There's local hyperthermia, there's regional hyperthermia, and then there's whole body hyperthermia. When you look at local hyperthermia, it's much more of an ablative technique, more consistent with conventional, if you will. Not radiation, safer, but still directly destroying, seeking to destroy abnormal cells. And again, looking back at the recent literature on the previous page, they're associated with George W. Crowell Jr. in 1962. He was able to show that these high ablative temperatures could actually still preserve the healthy tissue. Regional is just broadening that out from just the direct treatment of a tumor or of a lymph node. So you could treat regionally, so maybe a whole breast into the lymph nodes. And then, of course, one of my favorites is whole body hyperthermia. In the season of the treatment of cancer at Brio Medical, what we do is we use both local hyperthermia and whole body hyperthermia. Local hyperthermia gives us that ablative targeted therapy when we can use that. And then whole body hyperthermia is really helping us to provide a systemic elevation of the immune system. So what is hyperthermia by a dose and duration perspective? Well, what we're going to use here is we're going to go back to the Germans because they are probably some of the most well-published on this, and they've done the best to categorize through evidence the qualities, if you will, of the different phases of hyperthermia. So they published in 2018 a German Society for Hyperthermic Scientific Advisory Board. And they devised 3 categories: mild, moderate, and extreme or severe. Mild, looking at dose and duration, found the duration of basically less than 30 minutes or greater than 30 minutes. So they looked at both, but they found that the temperature there was less than 38.5 degrees Celsius or 101.3. So the duration could be, 30 minutes, 60 minutes, 90 minutes, but the temperature was kept below basically 101.3. The indication here: wellness, rehabilitation, healing, orthopedics healing. So not really a cancer therapy. But yet most of what's out there that is marketed as hyperthermia in cancer treatment is not cancer therapy, it's marketing. So here we're talking about duration being, uncontributive to the process of mild hypothermia. It's really the dose or the temperature. Now, moderate, again, according to the same 2018 German Society for Hyperthermia Scientific Advisory Board, looks at the duration at, again, less than 180 minutes to greater than 180 minutes, so much longer in duration. But the temperature here, the dose, they're really raising it up. 38.5 to 40.5. So that's all the way up to 104.9. So now we're getting hot. It's getting hot up in here. And here, this is where the documentation, according to this advisory board publication, a review of the science, starts to creep into the AntiCancer Mechanism. And you can see that listed there on immunology, oncological, as well as chronic infections. So here you can see we're not just guesswork. We're actually looking to the evidence and then thus the publications of that into categories to help to guide us about what's the dose, what's the temperature, what's the duration, how long. Because if we're going to get an immune boosting and anti-cancer mechanism, we want to make sure we're following the evidence. Being in integrative medicine doesn't mean we just make things up. We actually follow the evidence. Being in the science, being in the evidence actually makes one, I think, physician-wise, be more integrative. We don't run from the science. We actually need to embrace it. And then we step into the extreme hyperthermia or severe. So here we're looking at the highest dose, that is temperature. So we're talking above 40.5. That's above 104.9. We actually target 40.5 to 41 in Brio Medical when we treat hyperthermia patients. We had a patient today. She was right about 40.7, 40.8. So, but look here at the duration. So you hit this higher temperature and you shorten the duration, 60 to 120 minutes. So when I talk to the patients, so look, here's our target. We want 40.5 to 41. But what we want is 1 to 2 hours. They go, oh, well, where does that come from? Oh, that comes from the scientific literature, published in 2018 from the German Society of Hyperthermia, who has and that culture has the most contribution to the arena of hyperthermia. So that's where we get this from. And this clearly targets cancer. Now, I've already mentioned ablative. That's more in line with local hyperthermia, where you can actually go even higher, 48 degrees C or higher. We go to 48 degrees Celsius. And again, this is just a straight on targeted destruction of a tumor. So if there's a tumor that you can target, and that this would depend on location as well as depth, you can actually use local hyperthermia to destroy cancer cells. And this in turn will activate the immune system. You can use local hyperthermia in conjunction with whole body hyperthermia, but understand we're not going to do these on the same day, and we're going to actually leave these divided out. And again, I mentioned the Dr. Crowell Jr. saying that you could target the tumor and you would destroy those cancer cells, but not harm the healthy cells. Now, this is where I like to get on my horse a little bit, or get on my soapbox, if you will, because a lot of people advertise hyperthermia. What we want to do is we want to be effective. We want to be innovative and elevate the practice of integrative oncology, but we want to be effective. We want to follow the science. We want to heal and eliminate cancers. When you undershoot the temperature, the evidence says there's actually a risk of propagating, of promoting, of increasing the cancer growth. So research points to inadequate, unsuccessful hyperthermia as the potential stimulus for angiogenesis, blood vessel supply growth, aggressive growth, and epithelial to mesenchymal transition of cancer. And this is essential to cancer growth and metastatic spread of cancer. Just a few highlights from, a few titles of literatures. One is 2012. The title is Insufficient Radiofrequency Ablation Promotes Angiogenesis of Residual Hepatocellular Carcinoma via Hypoxia-Inducible Factor 1 alpha and Vascular Endothelial Growth Factor. Another one published in 2014, Incomplete Radiofrequency Ablation Enhances Invasiveness and Metastasis. Insufficient radiofrequency ablation promotes the growth of non-small cell lung cancer cells through P13K, AKT, and hypoxia-inducible factor 1 alpha. That's 2016. Low temperature radiofrequency ablation of the target site can facilitate rapid progression of residual hepatic carcinoma. That was 2010. And then 2017, microfluidic-based mechanical phenotyping of cells for the validation of epithelial to mesenchymal-like transition caused by insufficient heat treatment. That was 2017, as I mentioned. So when we look at raising the heat, raising the temperature, we have to understand there is very much a target. And if we miss that target low, we actually may be getting the unintended effect of promoting the cancer growth. So this is not to be taken lightly in the least. Then what we want to do is, beyond missing the target and propagating the growth of cancer, is a concept called Thermo Tolerance. And this is hyperthermic-induced Thermo Tolerance via the sublethal hyperthermic induction of short-term memory adaptive resistance. So just as cancer can become chemo-resistant, just as it can become immunoresistant, just as it can become radio-resistant, it can also become resistant to hyperthermia. So if we don't use a therapy correctly, we could actually propagate the very thing that we're trying to eradicate. This is why the practice of precision medicine is so important. We must know what we're doing, what we're targeting, how we're targeting it. It's the right treatment for the right patient at the right time, in the right way. So all about frequency. So when we talk about local hyperthermia, we're probably talking about 2 times a week. Whole body hyperthermia, because it's such a significant procedure, it's about once a week. So what are the anti-cancer objectives? We'll start to get to your questions here in just a moment. It's destroying cancer cells. I mean, that's obviously one of the major goals of any cancer therapy, hopefully, whether that's direct or indirect. And that's a term called cytotoxic. It's immunomodulatory. Fever is a manifestation of the immune system. Anytime you get a fever, that's not a bad thing. This is why, remember, I've talked on the podcast about Tylenol being immunosuppressive. And in cancer patients, that's the last thing you want to take is Tylenol. Immunomodulation means it can modulate the immune system in one way here and in another way there. It augments and is synergistic with other therapies. Hyperthermia has been shown to augment chemotherapy. It's been shown to augment radiation. It's been shown to augment immunotherapy. So it is a therapy that you can stack together. And thus I call therapy stacking a term, where you bring together these therapies that provide multi-prong attacks on the tumor in the pathways multi-omically, genomically, epigenomically, transcriptomically, to really target the cancer every way at the same time as best we can. And then, of course, it is increasing oxygenation delivery to the tumor. Why is that important? Well, a lot of tumors are hypoxic. It doesn't mean they all are, but also it's that oxygen presence within the tumor and tumor microenvironment that allows us to deliver pro-oxidative therapies, getting back to the cytotoxic or cancer-killing effects. Without oxygen, therapies are less able to deliver that oxidative burst that can destroy the cancer cells. So broadly, in an anti-cancer mechanism, it has direct tumor damage. It's anti-growth. That's what proliferative means. It's pro-apoptotic. It's anti-inflammatory, anti-angiogenic. It's directly cytotoxic. It inhibits epithelial to mesenchymal transition, and that in turn makes it anti-metastatic. And why is that important? 90% of cancer mortality and morbidity is when cancer spreads. What hyperthermia is not, it's not a steam box. It's not a steam tent, a sauna, a hot bath. It's not a 30-minute procedure, 60 to 120 minutes for the severe or high temp. It's not a suboptimal temperature. It's not a simple process of sweating or a measure by surface temperature. It is a measure of core temperature, very important. It is in fact a patient-directed procedure in part. It requires very little monitoring during the procedure. We actually monitor the patients via technology to monitor their cardiovascular system, pulmonary system, and core temperature throughout. You don't knock them out. We like to use medical cannabis to sedate patients. And of course, there's great broad literature preclinically and some clinical on the speculation that cannabinoids, CBD, CBG, THC, not speculation, but they have broad anti-cancer effects. And this is important. Anything with the head involved in the heating process, that's not hyperthermia. So if you're going and sticking your head in a steam tent where your head's in it and you're there for 30 minutes, though that may make you hot, that is not a core temperature hyperthermia. And then in closing, I wanted to touch on this concept of spontaneous regression, going back to St. Paragan. And this was an interesting comment, quote from a Journal of Oncological Science, a quote from an article in the Journal of Oncological Science entitled Spontaneous Tumor Regression, ? The reason why it's observed less frequency at the present time may be that conventional cancer treatments with immunosuppressive effects are administered more often and early in the course of therapy. So basically, the conventional strategy is just destroy the immune system. And so what we're seeing is this process of immune destruction. Part of that's through cancer therapy. Honestly, part of that is just life today. But this is something that's being passed on generation after generation after generation. It's a legacy effect. And what that's leaving is the immune system's inability to respond, and thus the inability to provide spontaneous regressions. So when we look at hyperthermia in closing, instead of the calm before the storm, the fever is the designed storm of the immune system that brings forth the calm. That's the power of the immune system. That's the power of hyperthermia. So this has been a very brief overview of hyperthermia. I wanted to give opportunity for Q&A. And so thank you very much, Shawana. Thank you for putting this together. And so here's some QR codes. The one on the right will take you to Research Rapid, really great AI that helps on the evaluation and cross-connectivity of studies. And then if you want to check out websites, social media channels, and resources and contact information, the QR code there on the left as you face the screen. So now what I want to do is, after that brief discussion, I want to just kind of open up for questions, and let's see where that takes us. Let's see. Do I got anything here? Do we have any questions? Okay, here we go. Great. So all the questions, thank you very much for your time. I'll try to get through as many of them as I can in our time allotment. We have 30 minutes here. Bernadette said, I have a portable infrared sauna at my home. Does the heat from this type of sauna penetrate enough to be effective? Bernadette, unfortunately, no. That's a therapy I think you clearly put into the mild category. It can help with osteoarthritis. It can aid detoxification, but it is not going to be a hyperthermic core temperature effect per the evidence that actually will be anti-cancer. So unfortunately, no, it won't, but it does have other wellness and health benefits. So I'm not opposed to infrared saunas out there in general, but here in the treatment of cancer, it's something that I don't necessarily advocate for there. Is hyperthermia FDA approved? Well, let's see. Hyperthermia is approved in Europe. It's approved in Asia. It's been around for quite a number of years, approximately 60 years in terms of a therapeutic perspective, treatment perspective in oncological conventional medicine. But as an FDA therapy, they have not currently approved that in conventional care. There is a lot of experimentation going in. There's some clinics around the country, but hyperthermia is a very, very safe procedure, but I am not aware as of current that it is a approved FDA therapy. I know they're looking at some devices from a conventional oncological perspective. But, I mean, when you look at it, does FDA have to approve a fever? Let's see. Rosa Barg, do you agree with the practice of injecting bacterial product to induce a fever? They do that in Germany. Well, we used to actually use high melatonin and low-dose interleukin-2. Interleukin-2 is actually a cytokine, and so it's an immunostimulant. And there's some literature out of Europe, some actually good literature, showing that will actually be destructive to cancer cells, and it will absolutely induce fevers. We've seen that when we gave it to patients. I would tell them, look, you're going to get a fever, 101, 102, 103. And so when they'd come in, I'd give them a fist bump because they know, hey, I killed cancer cells last night. We can even do that, though, with mistletoe. There's forms of mistletoe that allow us to induce fever. It's called mistletoe fever induction therapy. So when you look at what they're doing in Germany, they're doing something that's more consistent with what Dr. William Coley did by giving heat-killed bacteria to induce immune response. That's a powerful therapy. There's no question about it. The thing we have to be careful of there is being able to control that therapy, meaning control the fever response. Sometimes that fever will get out of control. And that was one of the downsides of the Coley toxin and why the tide for a moment turned against Dr. William Coley, because it's really interesting. He was lauded. He was praised initially for what he did. Then when we had the advent of more conventional therapeutics, and then of course his therapy was tough. I mean, some of these fevers would last days, and they would be incredibly high. These patients would, of course, be admitted to the hospital. So there was a point where he actually became ostracized, ridiculed, marginalized. Yeah, probably called a quack. So if Quack Watch had existed then, guess what? He would have been right there on the top. Quack Watch, Dr. William Coley. Well, William Coley. You know what's interesting about Dr. William Coley now? He's considered the father of modern-day immuno-oncology. Isn't that interesting? Just to circle back around and go, oh, he was right. He was right. So do I agree with the concept? Yes. Do we have that ability here in the U.S.? No. Again, the issue to be concerned about there is being able to control it, because sometimes that fever just gets out of control. And I think patient selection there is very, very important because fevers can be very, very catabolic, very destructive to the body. And so if you have the wrong patient, the wrong selection of patient, and you do that, then you have a problem. Also, too, I think it's important to make a point here, not direct to your question, but one I think in general for everybody, because of what we're dealing with so much immunosuppression today in our culture, because it's not just something we have, it's something we're inheriting from our parents and we're passing on to our kids. And if they've had prior conventional therapy, it's going to be much harder to elicit an immune response. So if a patient's had maybe 6 months of chemo, round after round after round of radiation, their immune system is just not going to respond. So you could give them chemo, you could give them a heat-killed bacteria or two, and you're just not going to get a good immune response or a fever. We see that even with whole body hyperthermia, with a compromised immune system. We've got to support the immune system first. We cannot take natural, holistic, and integrative treatments and fall prey to the same thing that conventional medicine has done, which is one-size-fits-all approach. We must look at this holistically and recognize how everything works together. Compartmentalization here does not apply. One other thing here, question: what therapies, what cancer effects are best treated by hyperthermia? That's a question I often get. Probably number one, bone metastasis. No question about it. I had the pleasure of getting to learn this from a physician from Japan, and I asked him that question. It was through a translator, but he said, without a doubt, and he'd done it for 35 years, hyperthermia is the best treatment for bone metastasis. And let me tell you what, in my experience, having done this now for about 4 years, almost 4.5, he's right. He's right. Very effective in bone metastasis, on imaging, on labs, on symptomatic improvement, pain associated with bone metastasis, and there's no pain worse than the pain associated with cancer that is spread to bone. Why aren't you doing Dr. Coley's method? They do it in Mexico. Well, again, I think we have to consider the patient. It's the right therapy for the right patient at the right time. Heat is a very catabolic process. If an immune system is compromised and you give hyperthermia or you give Coley's toxin, you're not going to get the response. I don't care what it is. So there has to be thorough evaluation, thorough support of the immune system. If it's not in the proper context, the proper function, you have to support that. And understand, even in some of our patients, hyperthermia may not be a treatment option. Heat therapy is not, a fever induction treatment therapy is not a treatment option for everybody. We must remove ourselves from the one-size-fits-all approach. Fever, hyperthermia, these are tough therapies. And to just treat them as a mild conventional IV or the likes is in and of itself very dangerous. In the same light, they can be very effective. But if you don't have proper selection, and if you don't have proper management of that fever, you can actually really hurt the patient more than you can help the patient. And again, when you look at fever, even if it's a infection-inducing fever, if you don't hit that target, it's the same as hyperthermia not hitting that target. There's a lot of people that advertise hyperthermia fever induction therapy. What I want you to take from this is not necessarily the technique. In cancer, especially stage 4, when we have such immunocompromised individuals and where we have such metabolic mayhem to the body, we need to control it as best as we can, because these patients are already, most of them, in a cachectic state where the body's wasting away. Metabolically, they're hanging on by a thread. Immunologically, they have no function. And if we just light a bomb, that could be a bomb that blows it all up. Not meaning the cancer, meaning their body. And so being able to control this, but yet harness the power of the heat, that's what's important. It's not the technique, though that's important. It's harnessing it and controlling it that is really important. Look at it as it relates to chemotherapy. Full dose chemotherapy will absolutely destroy everything. That's unharnessed therapy. That's just like infectious therapy, We could just tell somebody, let them go get a urinary tract infection and get uroseptic. But obviously, that is not controllable. It's hard to control even at that. But if we can harness it, but yet control it, then we can take advantage of the benefits of it and yet eliminate most of the detriment that's associated with it. Let's see, got a little bit behind here. How many sessions to see results? I think that depends, especially if it's local hyperthermia versus whole body hyperthermia. Local hyperthermia, you can see effects with one treatment. Now, what I mean by that is you're going to actually see a swelling of the tumor. Because when you kill these cancer cells, guess what? The immune system gets attracted to it. The immune system comes in there and starts to work to clear out those cells. Now, it's a lot more complicated than that, but you can actually see some swelling and then it'll shrink. And it'll swell and then it'll shrink as you go through the different therapies. But as it shrinks each time, it gets smaller and smaller. Whole body hyperthermia, typically you're going to need about 3 to 4 sessions, I think, to really see significant effects of what you would see there being on labs, tumor markers, metabolic markers, inflammatory markers, ferritin. It's a great therapy to aid ferroptosis. But when you look at bone metastasis, I've seen bone metastasis essentially show healed metastasis, which you can see on repeat PET-CT scans or MRIs after 6 therapies. So I would say 4 to 6 therapies on an extreme situation of cancer that's spread to bone with whole body hyperthermia is clinically what I've seen. Now, has that been published in studies? No, but that's what I've seen. Okay. Somebody said I'm based in London. There's no question there. Okay, Loren, thank you very much for joining us from London, UK. It's a little late over there. My son-in-law is from up around Manchester way. A little shout out to Jack. I know he is a Manchester United fan. Actually, no, he's a Manchester City. He's going to shoot me. See, what are your thoughts on the correlation between parasites and cancer? Wow, that's a good question. When you look at, we'll use this first. The World Health Organization has said that 15 to 20% of all cancers are caused by infectious diseases. Now, I think it's much higher than that. Viruses, bacteria. So viruses would be Epstein-Barr virus, human papilloma virus, HIV, hepatitis C. Let me add in SARS-CoV-2. Bacteria, H. pylori. So gastric ulcer, parasites, liver flukes causes hepatocellular carcinoma, cholangiocarcinoma. So absolutely, when you look at the 3 of those infectious disease causes, viruses, bacteria, and parasites, it's really interesting what they do. They replicate, they grow, they spread, they have high metabolic rates, and they evade the immune system. So what we have is infectious sources that contribute to cancer and can actually cause cancer, but they will actually aid the cancer. So that's probably one of the processes of what the SARS-CoV-2 virus can actually do, is reactivate some of these latent viruses that are carcinogenic, like Epstein-Barr. There's actually a few case studies actually reported, hepatitis C, human papilloma virus, Epstein-Barr virus, showing how that's happened. So is cancer a parasite? No. Do we look at parasites? Oh, you bet. Because what do parasites show us? It's a part of the gut evaluation. And let me tell you what, I just did a podcast with Dr. Sabine Hassan in California, just a world expert on the gut microbiome in the treatment of disease, evaluation and treatment. And let me tell you what, health or disease, it's on a spectrum. The question is, which way does it go? And it very may well be the gut microbiome that does that. So parasites, yeah. Do we test? Yes. Do we treat? Yes. Is cancer a parasite, which is a question I get? No, it's not. But when you look at the treatment of many the antiparasitic therapies, ivermectin, niclosamide, mebendazole, albendazole, these antiparasitics are all anti-cancer. And in fact, we just, Dr. Paul Merrick, Kathleen Brody, and Dr. Pierre Corey and myself, and a few others we made a soft announcement of a multi-center observational study on ivermectin in the treatment of cancer. You know, what's interesting about that is we're just asking a question. And when you look at ivermectin, it is utilized, they discovered it in the soil. It is utilized by microbes there, single cell organisms, to actually combat invaders that didn't or don't have an immune system. They don't have self-defense. So they would secrete these ivermectins and release them out into the soil, and this would kill any invaders. So when you think about it, it's, ivermectin is kind of a bioweapon, right? That's Dr. Kathleen Ruddy's idea. So here, when we have a compromised immune system, ivermectin could be a very similar strategy, though it's an antiparasitic. It's a very similar strategy as what that single cell microorganism would be using. I'll actually be recording a podcast tomorrow. Check that out over at the Practicing with Dr. Nathan Goodyear podcast when we drop it, but we'll be recording that tomorrow and actually walking through the science of ivermectin and cancer. It's quite interesting. There's a lot there. So we'll be talking about that, and that relates to parasites. Will the temperature be the same across all ages, or does age change the temperature you use for different patients? Very good question. And this is why I don't care for or don't prefer the infectious approach, Coley's toxin. And there's actually a different approach in Japan. Is because when we have a frail person, when we have a person that's cachectic, very thin, muscle loss, very low weight, and metabolically, cardiovascular wise, they're not in a good place, and you induce a fever, you may induce a fever you cannot control. And so that's the benefit of hyperthermia, is you can harness the power of the fire, of the heat of the immune system, but do it in a very controlled manner. Because guess what? As soon as we hit that 2-hour mark in that target range and we turn it off, guess what? The patient starts to cool. So it's a very controlled process. So yes, the age does dictate what our temperature is, and a lot of it has to do with their overall health, their overall immune system. Some people's immune systems are so damaged by treatments that we can really only get 39 to 40. Also understand, if somebody's fasting, that's going to keep their core temperature, and this is very important, core temperature. So if somebody's measuring just with just a skin. We actually use this is a sports technology that they actually use in training for athletes in the Olympics. So it's very, very correlative, is to actually correlate your core temperature with your skin temperature. And the reason why they do this is they do it because they're trying to maximize their training. They're maximizing their training. And by doing that, they've got to know what that core temperature is. And of course, they're sweating and they're hot. And so they've correlated this with algorithms and been able to show right to the T the temperature. So yeah, the health of the individual, the age, all of that goes together. But that's why I like the conventional, the hyperthermic. It's controlled, and we can really keep the side effects to a minimum. Very safe procedure. I know it sounds quite involved, but it's a very, very safe procedure. What's the risk of this treatment for someone sensitive to heat exhaustion? Good question. We've had plenty of patients that have had a history of heat exhaustion, even stroke. You have to be careful. You have to monitor it. And this is why you take a stepwise approach in the temperature, the dose. So you don't just start off and say, let's hit 41. You work your way up. Of course, we want to get above 39, and 39 degrees Celsius to 39.5 is well tolerated by almost everybody that we've done this procedure on over the last 4 years or so. So you got to walk your way up to it. And in that process, it allows you to really assure that the patient is going to tolerate it. Of course, we monitor patients through this. We monitor their cardiovascular system, EKG, their pulmonary, their urine in, their IVs in, and urine out. By the way, I didn't really touch on this, but therapies used in conjunction. We use therapies actually in conjunction with this. Vitamin C, curcumin, and research shows that the heat augments the vitamin C. The heat augments curcumin. So really, really great synergism there. Somebody is referring to a test here. I won't leave the 4 letters out. I'll leave the 4 letters out. I won't mention it. That shows my breast cancer won't respond to hyperthermia. Can I trust that? I would say no. Here's the... There's testing out there that tries to oversimplify an insanely complex problem, of which we have no idea how complex it is, the immune system. There is this process called cold and hot tumors. Cold tumors are tumors that don't have a lot of immune infiltration. And so if you're doing things to stimulate the immune system, you're not going to get that effect because it's just kind of buffered. It's cold. The immune system has very little effect. But hot tumors are tumors that you can actually use the immune system in. And in fact, when you look at a PET CT scan, everybody looks at the CT and the PET. And the PET, they give that radio-tagged glucose, and the tumor lights up. There was some research done, published in 2022, a team out of the Midwest, can't remember what state, but they actually showed that most of that's lighting up in and around the tumor is actually the immune system. It's the immune system. So what a test like what you're describing there, they're saying that hyperthermia won't work. Well, it could be it's a cold tumor. But understand, it's about the immune system. It's not about whether hyperthermia works. It's about whether the immune system is active, whether the immune system can target, whether the immune system can communicate, whether the immune system can penetrate the tumor microenvironment. And here's an interesting aside. Ivermectin has been shown to turn cold tumors hot. I'll be talking about that study tomorrow on the podcast, so look for that when it drops. So I would say that evidence is null and void. That is related to its hyperthermia is not going to respond. It's not going to respond to hyperthermia. I think it is oversimplifying a beautiful concept of the immune system. And in oversimplification, they are creating a picture that is false. Because it could be that it's just a cold tumor. Well, guess what you do? You make the cold tumor hot, then you sick the immune system after it. Okay, here's a good question. This is off topic, but I don't think it's off topic. If we're talking about hyperthermia, we're really talking about immune system. And what I say as it relates to the immune system, the best answer to cancer is never get it. But beyond that, the best answer to cancer is the immune system. So this is off topic. Do you think that GCMOF, granulocyte macrophage activating factor, will be the immune system to attack cancer? This is a good question. This is a therapy that a lot of people will employ. It's called GCMOF to really activate certain innate immune cells, macrophages, to engulf cancer cells and alert the rest of the immune system. If your immune system is not correct, if your immune system is not penetrating the tumor microenvironment, understand that one of the things that cancer does is it will attract the immune system to it. It will attract neutrophils, it will attract macrophages, and these in turn can be manipulated by the environment of the cancer to suppress the immune system. So if you have a process where you have immunosuppression, if you have immune evasion ongoing and you introduce GCMOF, that is the wrong setting to introduce a therapy like that, because you actually could propagate the M2 polarization within the tumor microenvironment. And what that's going to do is actually aid and abet the cancer. It's about the right therapy for the right patient at the right time, right? It's about precision therapy. And so if the immune system is activated, if the tumor's hot, and through testing, if we're able to determine to the best of our ability, because understand there's a lot lacking there about what's going on in the tumor microenvironment, what's going on in the tumor. We assume when we look at the blood, that correlates to what's going on in that environment. We're assuming that. We don't know. So if the immune system is activated, if it's hot, if it's communicating appropriately, if there's not, excessive iron, hypoxia, and you can keep M1 polarization, if you can control neutrophil extracellular traps, if you can control all this complexity that's involved, then yes, GC-MOF could be a helpful therapy. But without truly knowing what that environment is, I think you're rolling the dice. And that's why I don't use it. That's why we don't use it at Brio, because there's too much unknown there. Here's a great question. Would this be a good treatment for somebody with 3 primary cancers, prostate, bladder, and non-small cell lung cancer? Great question. We are going to be interviewing a patient of ours, a past patient of ours. Charlie is his name. In June, I think it is. He has had 5 different tumor types. And guess what? He is cancer-free, living with his wife, enjoying his girls, and captaining his boats. He's not just survived, he's thrived. He's thriving. So yeah, absolutely, that is a great therapy there. But again, we have to understand too that one therapy is not going to be the treatment that cures all with cancer. It takes all therapies provided in sequence and combination and stacking in a precise mode based on multi-omic evaluation. Do you give IV glucose during whole body hyperthermia? We don't. We do give IV therapies. I mentioned curcumin, melatonin. We'll use vitamin C. And these therapies are augmented together with hyperthermia, but we don't give glucose. In addition to hyperthermia, does your clinic incorporate the use of B17? Read a lot about this, and soursop tea for cancer as well. Yeah, we do use B17 IV. It's a great therapy, well tolerated, safe. Soursop, not soursop, a little typo. Soursop, a lot of interesting literature around that. We don't currently employ soursop tea, but down in south of the border, there's a lot of cultures and a lot of tradition and some evidence on soursop there, definitely. I'm stage 4 breast, liver, and bone cancer. So I guess primary breast cancer with liver and bone cancer, grade 2 triple negative. What supplements are good to take while getting chemo and something? EC, I'm not sure what that is. Well, here's what I would say about chemo is a pro-oxidative therapy. And I think it's always advisable to communicate with the oncologist. So what you want to avoid in conjunction with chemo is antioxidative therapies. Now, people would go, oh, so that means no vitamin C. Well, if you're going to give IV vitamin C and make it a pro-oxidative therapy, oh, you bet. That's a great combination. Hyperthermia, another great combination with chemotherapy. So there's a lot of supplements that we could use there. I think we have to be very careful because I don't know your current labs and what they look like. But I would say that there actually are many supplements that can be employed. I would say that also there are many natural therapies, IV, that can be employed. I think the balance between that would be, are they antioxidative and pro-oxidative? And the difference between that could simply be divided by how they're delivered and how they're dosed. Isn't that interesting? Dose and duration applies to hyperthermia just as it applies to these other therapies. Oh, here's a great question. Hey, Gene, do you recommend treating Lyme disease with hyperthermia? Yep. Remember, if you go back to that mild, moderate, and extreme, the moderate and extreme infectious disease, hyperthermia is there. Absolutely, Gene. But here's the other thing I would say about that is with Lyme, you could have much more of a Jerick-Herxheimer reaction. And so that's something we've seen that has occurred a little bit with IVCBD. And that's easily managed with some vitamin C, magnesium, etc., preemptively. But Lyme's disease tends to have more of that Jerick-Herxheimer reaction. And so we don't see that really much in cancer. Most of that's probably because of a compromised immune system. But absolutely, you bet it is a treatment for Lyme. Would be a great one, but of course we don't treat Lyme. Really good questions, well thought out questions. Let me see if I missed any here. Great to actually have people here from across the pond. And so if you've not already said goodnight, thank you for joining us. That's right at about an hour. Great questions. I hope this has been instructive. I hope it's been know, enlightening, and empowered you to understand what is hyperthermia. We will be doing a series on the podcast talking about hyperthermia, so know that we will be diving much deeper into this. We'll be going down some rabbit holes. Check out that QR code to take you on a tour down the rabbit hole of some of that research. Again, I really love that app because you can just start to really get yourself lost in the research and just have a lot of fun accumulating and an understanding there. So it was great talking to you about one of my passions, hyperthermia. It's a great therapy. It lets us tap into the immune system, work with the body, not destroy it. Novel concept. And what we're going to be doing is really stepping up this process of what we do with the webinars here, bringing you a high quality experience, high quality evidence. So look for this to come at you soon. I know our great marketing team, Daniel and the like, they'll send out some emails highlighting to you that we're going to be sending an email out that will then give you access to the posting on some of the other platforms. So thank you for joining us on this Thursday evening here in Phoenix, where we talked about the rising of the Phoenix. It just happened to be hyperthermia. I'm Dr. Goodyear. We'll talk to you next time.